Good afternoon, everyone, and welcome back to the Zero Downside Podcast. I'm Dr. Wade McKenna, and as always, we're sponsored by moabtexas.com. Today, we're going through the peptides, and I think that I'm trying to just give you the easy, quick, scientific data, plus our clinical outcomes and the clinical data, and what do we use it for, how much do people take, what's the complication and side effect of it. If you know that about a peptide, you know more than most people know about a peptide. All the different channels of how it works and all the science behind that, if you're interested in that, I can point you to the right place. But this is more about the generalized knowledge base. With that being said, if you're interested in starting your own customized peptide regime, then probably go to our website at Moab, Texas, fill out an input, our questionnaire to kind of get you onboarded, and we can get you the right people, and you'll get reached out to by staff members. They can help you get started on what it is you're looking for. Now, let's get into probably one of the peptides that started, one of the first ones we actually wrote for someone. And it was years and years ago, and it was in wound care and diabetic patients. When you have someone with difficulty healing a wound, especially with diabetic ulcers, it's not always about vascular supply. A lot of it is about collagen synthesis, loose skin, fine wrinkles, lines, hair loss. Those are all the things that would be helped with a peptide that improves collagen vascularity and increases the vitality of fibroblasts and the overall health of the tissue itself from a collagen synthesis standpoint, the tightening of loose skin, the removal of photo damage, hyperpigmentation, wound care. Those are probably the best uses of GHK-Cu. GHK-Cu is a copper peptide. It's extremely safe. The effect of the GHK-Cu, again, these are naturally occurring substances in the human body. At around 20, the circulating serum levels of GHK is around 200 nanometers millimole. As you get around 60, it may drop to like 80. So that's why your skin is looser. That's why your hair doesn't look as healthy. That's why you have more lines. That's why you have more hyperpigmentation problems. When your body's able to navigate the stream with a little higher GHK-Cu levels, you don't have those problems. And as you get those problems that we associate just with aging, it's not necessarily have to be a part of aging. GHK-Cu helps stem the tide, certainly with collagen synthesis. In our practice, the most common use of GHK-Cu outside of wound care is in the hair loss patients. GHK-Cu is a significant part of our hair protocols. We microneedle and inject the scalp, put people on GHK-Cu maintenance for weeks going after that. There's also a significant effect in any of the literature you pull up on increasing your body's own stem cell function. You need to be able to kick some of those cells out of the marrow. GHK can be a significant part of stimulating your body's own stem cell production. That's one of the ways it helps in wound care. So for us, GHK-Cu is the go-to when it comes to wound care, collagen vascularity, hyperpigmentation, hair loss. Certainly part of all of our regenerative medicine protocols when we talk about microneedling with cellular tissue for the skin, with PRP or bone marrow aspirate or the postnatal tissue grafts. When you're microneedling for skin health, to tighten skin, hyperpigmentation, fine lines and wrinkles, GHK-Cu is published for every one of those specifically in and of itself. It would be a big miss to go through all the trouble of a big procedure and not take the easiest hack we have, which is just nutritionally getting your GHK levels up. For us, it's a simple, easy administration of a peptide. The GHK-Cu is not a daily thing. Usually with GHK, we're talking about 8 times a month, maybe twice a week at 0.2 cc's. If you're a wound care patient and we're focused on one lower extremity, things like that, obviously those are going to differ. Again, if you're interested on a customized peptide protocol, go to our website and we can help you with that. I would encourage you to do that if that's something you're interested in. Otherwise, I think for our perspective, we think of GHK as mostly hair and skin and wound care. I do think it's crucial part of our post. Like if we have a back patient in, if we're given stem cells for some therapeutic effect, even in the clinic in the BVIs, when someone's getting IV cells, I think that GHK-Cu is one of those injectable peptide hacks to help you get the best out of the therapy that you're paying for and help improve your results. That's kind of the down and dirty on GHK-Cu for us. I think it's an incredibly important supplement or peptide. It's an injectable. There is a shampoo version that can help a lot. It's extremely expensive. It's not absorbed very well. I still think the injectable, as far as cheap, easy, effective, is probably the way to go. With that being said, thank you again for your time and attention. Please like and subscribe to this episode. Click on the notification button. And as always, thank you so much for your time and attention. And we genuinely are humbled by the trust our patients show for us. Thank you.